Right, Chuck.
Just as I typed that. All right. Well, welcome everybody. We'll get going then. So we are again here for our weekly update from the city, the county, Indiana University, and IU Health on the COVID-19 pandemic here locally. I am still Chuck Carney, Director of Media Relations for Indiana University. And as always, we will hear from Bloomington Mayor John Hamilton, from Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU Associate Vice President for Public Safety and Institutional Assurance Ben Hunter. And today we're going to switch things up a little bit. We'll start with Penny, who will lead us off.
Great. Thank you so much, Chuck, and I appreciate the opportunity to be here and share some news that we have. And I want to just kind of start with an update on what's happened since our last last press conference a week ago. I mentioned last week that we had peer educators that were going out and doing education about what social distancing is and handing out some bandanas for face coverings to people who may not have them. Our peer educators have provided over 60 of those kits and done the prevention education in the past week. They are reporting that people have been very receptive and appreciative of those kits. So we're glad that that is moving forward, and we'll keep you apprised of that as we go along. The coalition, the Communities Active in Disasters, the COAD, did send out their postcards last week. That was a targeted postcard with resources, 211, food resources. It had Helping Bloomington, Monroe on there, so that people that may be in need would know what resources were available in the community. So that went out. The Indiana State Department of Health and Indiana University Fairbanks study was announced last week and started on Saturday. We had a drive-through clinic here for that, and I think here they did about 50 or so tests last Saturday, and then that went Saturday through Wednesday. And at the end of Wednesday, I think they had around 4,000 tests that they had done. I'm not sure what the final number on that was. So they'll combine that information. That's part of an ongoing study that Fairbanks School and the State Health Department are doing together. Some good news, we did hear late last night that Monroe County is one of the sites for the additional Optum clinics. So we will have an additional testing site for COVID-19 in the coming weeks. So our public health coordinator is busy making those arrangements and finding a location for that site. And that should be up and going by the middle of May. So we're excited to have that other opportunity. You know, IU Health, and I want to thank Brian and IU Health Hospital for their testing capacity and the way that they have supported our community and all the communities that they serve with testing. We wouldn't have really any of the testing that's being done to speak of if it wasn't for them. And we're glad to have them. They've done a ton of testing and they will continue to do that. We're very grateful for that. But having an additional site will just mean that there are more options for people so we can get more testing done. And increasing that capacity for testing is really very important. Locally, our numbers have been pretty stable when you look at them, although today we did add 3 new positive cases to our case count. But we have to ask ourselves, are we testing enough people to really get a sense of what's going on in our community? So if testing increases with our new site and with continued testing from IU Health, and we have few positives, that could indicate that there's less virus circulating in our community, and that could be a good thing. But we would anticipate that with increased testing, we will identify increased cases. And the other good news is that the State Health Department, by the middle of the month, will have that enhanced contact tracing set up and going so that if we have additional testing being done and we are finding additional positives, we've got that capacity ready to go to handle the contact tracing that needs to happen. And while we have been doing that contact tracing, and then we have taken some help from the state on that, as cases increase, there's an enhanced need for that help. And so we're grateful for the state health department to be willing to do that so that our public health nurses can concentrate on other infectious diseases that need follow-up, and they can concentrate on pockets of activity that may be happening, whether that would be in a congregate setting of some sort or with a business or something like that. So the two things that I'm very happy about are increased testing and that contact tracing being enhanced. And that will put us in a better place to have better information and to monitor what's going on in our community so that we can really look at reducing restrictions in our community if needed. And we're able to do that, and then also allow us to ramp things up or back depending on what the situation is. I think everyone has heard me say this before, and everybody on this call, that before we reopen, that everything will have to be very strategic. It needs to be done slowly. We have not met the national criteria at this point to be reopening. But we are also all anxiously awaiting the governor's announcement in the next hour about what his plan for the state is. And then we can look at that and make decisions for our county based on our data and his orders and what's going on with that. We have scheduled a meeting for our business community that will be next week, and invites will be going out for that. And that will just provide an overview for local businesses so that they can see what the criteria is, what the expectations for them are from an OSHA standpoint, from a public health standpoint, and we can share guidance, and businesses will share some best practices. IU Health, Indiana University, Cook will be on that call to share that. And I know that the chamber and I think the city's group are putting together a robust website and kind of a virtual conference that's coming as well for businesses. So there's some good information that's coming up, and we just really want people to know that we need to kind of stay the course right now. National criteria, watch for that. We want to follow the data and look at what's going on in our community. And we will anxiously await the governor's announcement later, and then we will work accordingly to that. So that's mine. I'm excited that we're going to have an additional testing site. I think that will make it easier for people to have multiple options on where to go.
All right, thank you, Penny. Let's go to Mayor Hamilton. Oh, still muted there. Let me see.
Sorry. Just I thought I was number 3, but I'm happy to go ahead. Thank you very much, Penny, for that. And I am, from the mayor's seat, very pleased with the progress in the health system and the flattening of the curve. I think there's been a lot of good news. As Administrator Cottle said, the testing and the tracing are both really important things that we expect to see in mid-May. We've had continued progress with the financial assistance program. There's about 30 borrowers with about $750,000 in loans that have been approved or virtually approved and out the door, as well as the social services effort supporting shelter facilities, which have been utilized not intensively, which is great, but somewhat to give a space for people who need to be isolated, childcare, food support, all that going. City government has continued to be in full operations throughout this pandemic. We continue in full operations. We have had some facility closures, including City Hall and utility center and others, and those will continue. The facility building closures are expected to continue at least for another couple of weeks, but continue full service of the government. I think I just want to note, we do expect a statement from the governor. They've kind of queued up this Friday afternoon statement as something where we don't know what will be said, but expectations of some changes or plans. I think I would just like to say, and I appreciate Penny noting this, and I think Brian Shockney will repeat as well, that we locally have not met the CDC health-based criteria that are outlined as kind of the gatekeepers gating criteria to reopen. We have not met those so far as I know, in terms of some 14-day trends and others. So I feel quite strongly and am hearing from the health recommendations that until we meet those criteria, we really are reticent to open up anything new, but instead should attend to what could be done as we meet those criteria. And the governor has personally assured me, and I know others, that any statement that he makes in terms of loosening restrictions, he absolutely approves, and I expect him to say this at 2:30, local restrictions being tighter or slower, if you will, is perfectly appropriate, as he recognizes that situations differ and kind of the state is setting a floor, but we may feel locally that we don't yet have the CDC and health-based indicators that suggest loosening is appropriate. So I'm hoping that we will and expect that we will locally want to wait at least a week or two to do some openings. The other thing that lets happen is it lets us do better planning with any entities that are planning to change their operations under new restrictions, whether it's a shopping area or a store or other service providers, that we're able, through our health experts, to assure that they're being done in an appropriate way. Because while all of us want to see increased economic activity, and the recovery is very important, and many people are working hard to plan for that, we need to be first and foremost confident and certain that the health of our community is protected, from customers to employees to overall community transmission. And the other thing I'd noticed that, as Administrator Caudill noted, it's mid-May that we'll start to see some more of the testing and tracing capacities there, which then let us have more confidence as we are able to reopen for activities, that we've got the capability to respond in case there is a setback in one place or another, one facility or another. So emphasizing and repeating Administrator Caudill about staying the course, continue physical distancing, and we are doing that as city government, and expect our community to do the same. And I expect that we'll see a steady course here for at least a week plus as we evaluate what's going forward. But we'll wait to see formally what happens a little bit later this afternoon. Thanks.
All right, thank you, Mayor Hamilton. Let's next go to Monroe County Commissioner Julie Thomas.
Hi, everyone. Welcome to my backyard. I want to thank everyone for being here, and thank you for hosting. We appreciate your help, Chuck, with all of this. I absolutely agree with the mayor's statements. We are hesitant to start moving forward with planning to open immediately, because we don't feel like the data supports it right now. We're going to be reassessing this today. Depending on what the governor's order is, we will be coming back we're going to be recessing our 3 o'clock commissioner meeting to 5:30 in case there's any additional information we need to transmit at that time. So please join us. It'll be on Zoom through the Monroe County website and also on CATS, of course. We just want to note that we know this is really tough. We know it's tough for gig employees. It's tough for business owners. it's tough for everybody because we all want to get out there and get back to business and get back to work. And we so appreciate all of the effort that the community has made to flatten the curve. It's working. It's not perfect, but it's working. And so the Board of Commissioners, Lee Jones, Penny Githens, and myself want to say thank you. And please be patient. Stick with this a little longer. When public health works, you don't notice it, and that's a good thing. So we'd like to get to that point. But just a quick note, we provided some more increased support for local food banks this past week, including $20,000 split between Mother Hubbard's Cupboard, Pantry 279. Please remember, these food pantries are seeing a huge increase in patronage, and they need your help. Our local emergency order was extended through May 15th to match the state Supreme Court's plan to gradually reopen courts across the state beginning May 18th. And again, everything is going to be gradual. We are working with our department heads individually and as a group to find the best way to open the public-facing side of county government again. That work is ongoing. And we are continuing to serve the public through the website, through phone calls, and everything else we can do. That work continues through phone and email. So if you need something, please let them know. To date, we have provided grant funding for small businesses in the county outside the city of Bloomington of $163,852. That's to date. Future grants will rely on the governor's order today. If the governor does not continue the order for any reason, we will not be able to provide additional grant funding. But if you're not sure, just go ahead and apply, co.monroe.in.us. Also note, politics continues, and your election board has made a great decision to send applications for mail-in ballots for the June 2nd primary. And those are going in the mail to everyone who's registered. If you're not sure if you're registered, or if you'd like to apply for a ballot electronically, you can do so through indianavoters.in.gov. Check, make sure you're registered to vote. You must be registered to vote by Monday to vote in the June 2nd primary. So please, everyone, it's important that we all remain active participants in our democracy, despite the pandemic. They've found a number of ways to make sure that your voice is heard. So hopefully you'll take advantage of that. And with that, I don't have anything else. Thank you so much.
Okay, thank you. Let's go to Brian Shockney.
Yes, I want to just say that I'm very pleased with the additional testing we're going to get here, and echo the mayor's comments as well as Administrator Cottle's comments as well. We here in the South Central region and here in Bloomington and Monroe County, since the second week in April, have seen a decline in the severity of the cases. But I want to stress that we continue to care for a significant number of patients, inpatients in our hospital with COVID. And we do still have patients on ventilators. So we've seen a decline, but it's not been a steep decline, and it's been, I would call it a sawtooth. We meet with the administration of Monroe Hospital every Tuesday, and we've been comparing our data, and our data is very similar. And while they have seen a decline as well, we continue to see this kind of leveling off. But, you know, I would have had really said we're seeing a good strong decline, but the last couple days here here in Bloomington Hospital, we've seen a pickup in our cases. So we're not out of the woods yet. We need to continue doing what we're doing, and caution us to be very careful in how we approach any openings, and be sure that we follow guidelines as the mayor and Penny have outlined, and we'll follow them and the county's lead as well. So we continue to work with the Indiana State Department of Health across the state to look at where we can provide some surgery, some outpatient surgery for those people who have really some life-saving surgery that could be put off for a period of time, but no longer can be put off. And so we are looking at how we can do that. On Monday here in Bloomington, we will begin some additional surgeries. They will be few, and they will only be those that are very highly prioritized to those patients who need to get those surgeries completed because of their current situation and their physiological condition. We will continue to make sure that we're doing our distancing and masks, and the visitor restrictions will continue as they have. We're not going to let up on those in any way. We strongly encourage Hoosiers to seek treatment. We've noticed across the state, across the nation, and here as well, that our emergency department numbers are down, but we also are finding that people are starting to put some things off that maybe they should go to the emergency room for. So we want to encourage people. The emergency room is open for patients who do not have COVID-19. We have policies and procedures in place that keep you safe as you present to all of our IU Health emergency departments for care, and I know Monroe does the same thing. And we will be sure that you get the care that you deserve. So we just want to get that message out that they should not put off anything that is they feel is life-threatening, and to use the services. We also are working hard to look at how we open other services, to develop a plan for restarting those non-urgent services once we get further down the road. That is not this, we will not be looking at services in the next week, but further out. And in the meantime, we do have all of our pediatric practices, our OBGYN, our medical specialties, and all of those that continue to provide virtual visits. So you can still contact your physician and your nurse practitioner and your physician assistant, and you can get the virtual visit that our patients actually, we looked at our data yesterday, and our patients actually are giving us higher satisfaction rates, 8 to 10 points higher on our virtual visits than the in-person visits. So they really do work well. You're able to connect directly with your provider, get your questions answered, and they're able to support you in that need. So we really would encourage that. Lastly, the data, we did see the data that went out on Monday regarding IU Health, and we did see a 9.5% increase in our virtual visits. So that's good. People are using them. We did see a 30% increase in testing volume with IU Health. That's good as well. But as Penny said, this additional testing is going to really give us the data we need to make decisions about how we as IU Health open additional services, but I know for our elected officials as well. And then we did discharge an additional 20 patients, as we did have some additional patients with COVID admitted to our hospital this past week. And we continue to run at about 10% of our employees who test are positive for the virus, and those employees are getting that community. We're not, as we trace that, they're not getting it in the hospital, they're getting that through community contacts. So just wanted to share an update on those numbers that the press received on Monday. And with that, I'll conclude my comments.
Okay, thank you, Brian. Let's go to Allison Moore.
Good afternoon. I'm glad to be back. I was absent last week due to an illness, and kudos to IU Health. They provided great virtual service this last week to me. Wonderful systems in place, and unfortunately, I got to be one of those individuals that got to use those services. But the way that they have everything set up was wonderful, and very, very much impressed. So thank you, Brian, and to IU Health across the state of Indiana. Wonderful, wonderful service that I was provided. I have a quick couple things that I'd like to update. We did hear yesterday from the Indiana Department of Homeland Security that we are getting a drop of PPE supplies to our county. We are hoping to get that either by 5 o'clock today or Monday. So that's wonderful news that will be arriving to our area. They are providing the same amount of equipment across the state to every county. So it's not necessarily based on the needs or the requests that we had, in fact, requested for our first responders, but any PPE that we're gathering is of a great benefit for us. So we'll be sorting those supplies across and comparing what those requests were for our first responders, and divvying up those items next week. And our first responders are very excited, and we're excited to see what's in that palette of stuff that we get later today or Monday. I also want to not mention businesses at this time because I would not want to leave anyone out, but we do have a huge list of businesses that have provided things for our community. And some of those things are face shields, our gowns, our masks, and sanitizers. We have had so many of our local businesses and our industries that have not been able to run their lines and do the same exact work that they normally could do during this time, but they were still able to pay their employees to do something. And some of those shifted things around and were able to make the supplies and such for us and our first responders and our hospital staff and various other people. And so I just wanted that noted, that we are making that list of all those businesses, and we will acknowledge you. I don't want to list them on here, in fact, in case I would leave someone out, but many, many, many small businesses and large. And so we greatly appreciate those. Our office is continuing to still go and pick those up and then shuffle those around amongst our first responders in various departments and offices and nursing homes and such all across the community. And we will continue to do that. And we, of course, take any of those donations, and we'll be happy to shuffle those around amongst the needs that we have in our community. So thank you just doesn't even say enough, but we greatly, greatly appreciate those items. We are still collecting the homemade masks that I mention every month, in every call that we have. And I want just to be aware, those are starting to come in a little bit more, which is wonderful, as we do start talking about the stay-at-home order eventually ending, and the need for those masks in our community is going to be so much greater. So we greatly appreciate those, and we will continue to accept those at our sites throughout the county. And again, those location sites of the collections are on our website, and you can always, of course, give our office a call, and we would be more than happy to assist in any way to gather those supplies. And that concludes my report.
Okay, and a reminder, we'll get to the media questions here in a moment. Ben Hunter, your report.
Thanks, Chuck. We continue to do a lot of planning at Indiana University for the system. Yesterday, President McRobbie sent out an email to faculty, staff, and students throughout the IU system talking about how our approach is going to continue to be methodical and deliberate in our response to COVID-19. In that email, he did describe 5 different scenarios. Scenario 1 was an in-person teaching and research in the fall with some social distancing. We recognize that that's the scenario we all want, but may not be able to get there. And a lot depends on the public health and how COVID continues to spread or resurges in the fall. Scenario 2 is a hybrid reopening. That's the most likely scenario that will balance between in-person and virtual education. So we continue to go over that, and all our planning groups are working kind of towards that, since that's the one that we feel is probably the more realistic one. And then the last 3 are really more of a fall online and a spring face-to-face, or fall face-to-face, spring online, or an entire academic year online. We're really hoping with our planning efforts and everything that we're seeing that scenario number 2, that hybrid face-to-face and virtual, is where we can get to. With that, each campus in the IU system, all 7, have planning groups that are working towards these different scenarios. And within our Emergency Operations Center, we have a working group that is looking at every physical activity you can think of, from literally eating to being in a classroom to being in a lecture hall. How can we do all of that with the best health guidance out there? We are not alone. I've been in several calls with other Indiana institutions of higher ed and our Big Ten colleagues. All of them are doing these type of planning scenarios. And so I think it's yet to be seen exactly which one we'll have implemented in the fall. But we're very, very hopeful that we'll have some type of in-person presence back at IU. We know that faculty, staff, and students are wanting that. We know that it will be a new normal. Things will be different. And so there'll be a large emphasis on public health. Within our 7 campuses in different counties, different cities and jurisdictions, we'll work with our local county health departments. We'll work with mayors. We'll work with public entities throughout the state to make sure that we do it deliberately, that we're working together, making sure that it's a concise and methodical approach to how we deliver education. I think the fall, the groups, the work groups that I'm in, and I'm literally in meetings Zoom to Zoom each day, all these different work groups. There's a bit of an excitement in terms of planning. So we've gone through stages of unique grief in the IU system, to where almost disbelief that we're sending our students, faculty, and staff home, moving to virtual education, which our faculty have just done a tremendous, just an absolute amazing job at doing that. And I'm taking a course myself. I decided to take one for fun that's turned more into fun and work with everything we got going on. And the faculty, I know firsthand how they've approached this. It's just been excellent. And then our cycle is, kind of, I think, of depression of like what's going to happen. And now I think there's just a real excitement about, okay, can we plan? Can we do this in a way that's healthy for our students, faculty, and staff? So I think President McRobbie's note yesterday throughout the system really raised some spirits in that realm. It's like, okay, here are the scenarios. Let's get to work to see what we can do for our faculty, staff, and students. So we're going to continue that planning. We're going to continue to move ahead, but rest assured, we will be taking all the health guidance from both this federal, state, and local level, and wrapping that all into our planning before we move forward completely.
All right, thank you very much, Ben. We'll go to some questions. We have, first of all, from Ethan Burks at WTIU WFIU News for Penny Caudle. How many more people could the new site test per day? Where exactly will the new site be located?
Thanks, Ethan, for that. They tell us that the site will be able to handle as many as 132 people, so 132 tests. We are working on a site location now. We just got the word about this last night, and we have until this evening to turn in some suggested sites. We won't be making that final decision in terms of where it is, I don't believe. There's a lot of questions we still have, but our staff, certainly not me, but our public health coordinator has been busy today contacting various facilities that we have on our list and looking at who might be available and willing to help us out with that space. So as soon as we know when and where, that will certainly be shared.
Okay, for Julie Thomas, also from Ethan Burks, on Wednesday, the county's emergency declaration was extended to May 15th. Several businesses want to know, what does this mean for them? What types of restrictions will be placed on the county as a whole with this extension?
All right, thank you, Ms. Burks, for the great question. The order is really related to the functioning of Monroe County government. Our current stay-at-home order and limitations on bars and restaurants, for example, come out of the state. So our order is related to continuing to pay county employees to do their work from home, and it allows us to follow, as I mentioned earlier, the courts, the state Supreme Court's decision that the county court will be opening beginning around May 18th in a gradual way. So this is, and it really impacts the way that we function as Monroe County government if we cannot meet, how decisions are made, et cetera. So that's a separate thing from what is coming from the state. However, we have to see what the governor's doing today, and we will be listening to Dr. Sharp and our health department to make a decision about what needs to happen locally given the data that we have. And you can be sure that we will let everyone know as soon as a decision is made. So thank you for that.
Okay, from Dave Askins with the B Square Beacon for Mayor Hamilton. About the budget advance meeting, you hammered the point that government can be counter-cyclical. Council member Sandberg said this makes her think of FDR, the New Deal, and the WPA. You talked about the stubborn fact of the CO2 molecule. It sure sounds like your 2021 budget proposal in late August might unveil some kind of Green New Deal for Bloomington as a way out of the COVID-19 downturn. Is that what you're hoping to deliver?
Thanks. I actually think government should be countercyclical. It's one of the most important things we can do. Individual institutions facing the pandemic, facing the economic punch in the face that we've gotten as a community, individual institutions need to respond kind of for their own best interest and survival. But I do think a role of government is to be countercyclical, to try to minimize the damage, try to limit the cost and the expense and the pain that people suffer, as well as to accelerate the recovery. That's certainly something we take very seriously at the city. I won't go into much detail really on the budget. We've just started that process, but I did mention, and I will repeat, maybe one of the lessons of the COVID-19 is the kind of this stubborn fact idea, and that I do think our community and mostly our country has recognized that when you face something like COVID-19, it's facts, it's stubborn facts, and you have to address them with reality, with intentionality, with intensity. We have done that with science, with reason. And there are other stubborn facts like CO2 molecules keep concentrating and causing great threats to us. And economic disruption and income and wealth inequality is a very stubborn fact. So I did comment that, and I think it's a real important role for government to help deal with those stubborn facts creatively, intentionally, intensively, and indeed to be a countercyclical force. So we'll be trying to study that while we balance. Obviously, there's some significant pressures that come to governments because of this impact, both economically and health, and we have to balance all that. But I do believe in a countercyclical government, so keep your ears open for that. Thanks.
All right. Thank you, Mayor Hamilton. From Emily Ernsberger from the Herald Times, for Penny Caudill, are we the only last-minute addition to the OptumServe testing? How were we lucky enough to be chosen?
Thanks, Emily, for that question. Well, probably you remember last week the state announced that they were going to set up about 20 sites. I think they were being set up this week. Maybe it's the first of next week. And then an additional 20 or 30 would follow. So we are in that 20 to 30 that are following. And so we did just get word last night. It came rather quickly. We were hoping that we would be one of those communities. I think it's a combination of reasons. Certainly we have good resources here in Monroe County, but we also, as many tests as we are doing, if you look at that dashboard, that we could be doing more with when you look in relation to our population. We also have a lot of people who work here, but live in other communities. And so even though we have a stay-at-home order, we have essential workers who are coming to work in various different jobs, but may live in other communities that don't have testing. So we're sort of a natural hub, and I'm sure that that had a part in that decision. They didn't give us all the specifics of why we were chosen, but we were certainly hoping and expecting to be on that list. So we're excited to be a part of that. And I do want to add one thing. Dr. Sharp's sitting here with me, our health officer, and he reminded me of something that I forgot to mention when I was talking originally, and that as we do think about getting out more with the weather being nice and with us even thinking about restrictions kind of being lifted even a little bit, that when we're out in public, that social distancing will become more difficult, and it will be even more important. EMA Director Allison Moore mentioned this too. It's going to be more important that we wear those face coverings and those masks, and that we leave the medical masks to the medical community, but that we wear those face coverings when we are out in public and we can't maintain that social distance. So we really want to encourage people to start doing that now. We do get complaints about people being out at grocery stores and different facilities and not wearing them. So while we know that people are, we also know that not everybody is. So we encourage people to start getting used to it now, so that as restrictions are loosened down the road, that we can just be more accustomed to that. The other thing that he wanted me to remind people is that as we come into this season of people with their leases being up and moving out, that when we think about those move outs, we need to think about them differently. So we would encourage landlords and residents to really think about this, and that landlords should make sure that they're scheduling those move outs, that you're limiting the number of people who are involved in that face coverings are being worn, and that we're making sure we're not doing it when somebody's ill. That, if somebody is feeling ill, that we reschedule those things so that we're not putting staff or employees or residents at risk. And consider other ways that you might be able to do it. We're all learning new ways to do business, and maybe there are some alternate ways to do those as well. So just wanted to remind everybody about that. And we've had some questions about it. So thanks for the opportunity to add that back in.
All right. Another question from Emily Ernsberger from the HT for Ben Hunter. What is the status of Briscoe being set up for medical workers to stay? Is it up and going, and how many people are there?
So Briscoe is ready. We had it ready, I think, over a week. It has not been used by IU Health to date. Our tower at the IUPUI campus was our other facility. It has been used by IU Health, but we've not seen any use down here. And I think, I would defer to Brian, but it's probably just because of the case load down here versus Indianapolis.
Yeah, that's correct. We've, as I shared, the numbers of our infected employees and quarantine employees continues to be very small. And so we're not really utilizing any of, we're using a few, but very few of our sites for off-site respite and for our sick and recovering employees, which is a good thing. But when we do have that, we will be utilizing the hall for our team members.
Okay. We have a question that came in from Facebook from Joan Padawan. What type of testing will we have available, and what original deep nasal swab, throat swab, saliva, other turnaround time projected? And I would guess Penny maybe for that one.
Yeah, it will be the nasal pharyngeal swab. So it's kind of our traditional, what I guess I would say our traditional test that we have for it. I don't know the exact turnaround time. I think they're looking at maybe 48 hours. I truly do not have a lot of details at this point.
Okay. This also from Facebook, and this has come from several people. Are officials aware of the fortune.com article about Monroe County being a hotspot, and is this accurate? I see Julie nodding her head.
Who was that?
Well, go ahead, Penny.
Well, I was going to let you go first. We are aware of it, and I think that it is something to keep in mind when we look at all the different data that's out there. One interesting thing about that report is most of the communities in Indiana are ones that have universities, and that certainly may be playing a role in those statistics. But I know that Julie's had a chance to really look at that, I think, deeper than I have. So I'll let you chime in about that.
It is an interesting piece because it's a predictive model based on social media. It also includes a number of tests, but most of it is based on social media mentions of wanting to get tested or feeling ill. The last time they did this test, they had 100% accuracy, which was amazing to see. It's called Data Miner, MINER, and it's interesting. We are seeing apparently there is a social media mentioning increase of either wanting to get tested or feeling ill, and this would be a 2-week precedent before we actually would see a spike. So it's a predictive model. They had good luck last time. My crystal ball's in the shop, so I don't know if it's accurate or not. But it is just it's mainly based on social media reporting.
Okay. Well, Julie, we'll work on getting your crystal ball out of the shop and ready for next week, if at all possible. Not seeing any other questions here, and just a couple of minutes left. We'll go ahead and wrap it up at this point. We will be back again next week at the same time, 1:15, with another update. Appreciate everybody's attendance, and thanks for being here.
Thank you.
Thanks a lot, Chuck. Thanks, everybody.